Cranial nerve testing can be done in numeric order in a pretty quick screen, or it can be organized by kind of regions, functional regions of the face, which is how I tend to do my screening if I'm going to do the cranial nerves. I don't do them every time. It depends on the patient diagnosis. Do I expect them to be impaired? And the patient's complaints. So if they're having problems that I think may be visually related or perceptually related, I will definitely at least look at the vision related cranial nerves. If they talk about swallowing issues, if their talking sounds a little mumbly or garbled, I'm going to look at the oral things. If I look at and I notice there's a little bit of asymmetry in their face, or they're telling me about sensory changes in their face, then I'll definitely look at, kind of that motor sensory facial system with a little bit more detail. So for the sake of this flow, I'm just going to look at the eyes at this point, and I'll have a separate video for the oral stuff and then a separate one for the face. So if somebody is complaining about visual issues, I'm thinking about cranial nerves 2 for optic, are they seeing well? And then 3, 4, and 6 are the muscles that are involved in moving the eyes around as necessary. The eyes opening and closing, so 3 opens the eyes, and then 7 actually helps to close. So 7, I'll tend to get at the eyes opening and closing more when I look at the whole face, but it definitely all flows together. And again, the order is less important than making sure that you're targeting the right nerves and the right muscles. So rather than using a pen light test to test 2 and to test 3, I tend to ask people if they've noticed any changes in their vision. Are they having more trouble seeing? Do they have spots on their vision? Does it seem like they're missing things in what they're seeing? So I start with a few questions. And if there's a change in acuity, I'm probably going to refer them, but I could use an acuity eye chart if I wanted to. In terms of the eyes moving together, just at rest, I'm looking to see if both eyes are looking right at me, or does one eye seem to be looking over my shoulder or looking off to the side or towards their nose a little bit. That can give you some resting baseline information about a potential asymmetry or weakness in one of the muscles for the eyes. So I will definitely ask them to do some eye tracking. So look at my finger. I make sure that I look at the end of their range. Is there any nystagmus at the end? That comes up in the vestibular stuff we're going to do soon. Make sure that I look up and down. And I tend to do diagonals, like an X in a box, but you can also do an H. It doesn't really matter. You just want to make sure you look at their eyes in all 4 quadrants. Okay, so thank you for that. I have tested peripheral fields, so visual fields, by starting behind their visual field and bringing one of my fingers into view and asking them to tell me when they see it. It helps to detect somebody that may have hemianopsia or neglect. It's hard to tell them apart with just an ocular exam. But another way to do it that might be easier is to have a finger in each optic field and then ask them to tell you, while they look at your nose, which finger is wiggling. So if I say, Ryan, can you see the fingers in the periphery here? Can you see them?
Yep.
Okay, so look at my nose and tell me which one is wiggling.
My left.
Good.
Right.
Good.
Both.
Okay, good. So why did I do 2 of them at the same time? Is that a trick question? Well, kind of. I'm looking for something called the extinction phenomenon. So sometimes after a stroke, brain injury, or potentially a tumor in a specific area, the brain may preferentially attend to one side of their workspace over the other, even though it can see them both. So in isolation, they may detect the finger wiggling if it's the only thing that's happening. But when I do them together, so now, Ryan, I want you to actually have some inattention. So now when I do the test, tell me which finger you see wiggling. Stay looking at my nose.
Left. Right. Right.
Good. So now they don't see the left finger wiggling when they're both simultaneously moving. So that preferential attention in the situation where you've got multiple things like divided attention, that is an indication of some inattention or neglect as a perceptual deficit, which we'll talk about later in the semester, but that's the testing for it. The other tests I'm going to talk about on another video.